people, they are suddenly having a light bulb moment around the country, right? That there are these disparate health outcomes when it comes to communities of color. And they're just seeing it now around the COVID-19 crisis. But we know that this has existed since the founding of our country because of systemic racism that has existed in all areas of our society and manifested itself so clearly in the healthcare system. We've seen it with rates of asthma, with maternal health, with diabetes, with so many other areas. I think there are two big things that we need to do. We need Medicare for all. We need a system where people can access affordable care, quality care, prescription drugs that they can afford, and health insurance regardless of whether or not you are employed. And by everything I can see, Medicare for all is the best way for us to accomplish that. Also because it will address racial and economic disparities around health by providing coverage for mental health, disability, addiction, the particular needs of the LGBTQ community, full access to reproductive health care, which I've been so proud to fight for much of my career. We also need to address social determinants of health because we know that there are areas outside of the healthcare system that are negatively impacting healthcare outcomes for communities of color, whether it's trauma, education achievement gaps because of racial disparities, poor housing that's contributed to negative healthcare outcomes, poor access to transportation. We can keep going on down the list, but we can't fool ourselves into thinking that this is a new development and that it's something that can be only fixed by tackling our healthcare system. We need to address the societal inequities and the social determinants of health that are contributing to these healthcare inequities, to these poor outcomes, and we won't fully tackle the problem until we fully address the challenges facing our entire society.